Welcome to the Advances in Research and Innovation stream at SNOMED CT Expo 2025. Thank you to Daedalus for sponsoring this stream. My name is Nick Egerhaus. I'm the Global Vendor Engagement Lead and Customer Relations Executive for the Middle East, Africa, and North America at SNOMED International. I'll be your moderator for today's session. We'll address all questions at the end of the presentation, and for our online audience, please use the Q&A button to submit your questions to the presenter. For those attending in person, feel free to use the microphone provided in the room when the time comes. It's now my pleasure to introduce Nindya Widita Ayuningtyas from Institute of Health Informatics, University College London, who will be presenting Health Terminology Management for National Level Interoperability, preliminary result of a scoping review. Nindya, over to you.
Thank you very much. Good afternoon, everyone. So my name is Nindya. So I'm from University College London. Actually, this is part of my Master of Health Informatics dissertation. So it's about the health terminology management for the national level interoperability, and it is still a preliminary result of a scoping review because we still want to add more documents to this scoping review. And I want to acknowledge my co-author in here, so Saldi Yusuf from Indonesia, and also my supervisor, Paul Taylor from the UCL. So as we already know that a lot of countries has the national level interoperability agenda, which enabling a common understanding and meaning while the data is being exchanged. And to do that, we need terminology standards to represent the meaning. When a country wants to do that, they can adopt in existing international standards, for example, like SNOMED, or they can establish their own terminology standard to match their own needs. However, as we know that medical knowledge is always evolving, that's why the terminologies also need to be updated, and we need a systematic management to make it right. So when I was working in Indonesia to support the Ministry of Health, we want to start to thinking about our terminology management process. And at the time, we realized that there is no such a framework that we can use directly to come up with our terminology management process. So that's why this study was conducted to answer this research question. It's about what is known from the literature about how countries manage their health terminology standard within their national governing body to achieve interoperability. So I will focus on four specific research questions, which is about the scopes, the principle, the challenges, and also the knowledge gap about terminology management at the national level. Starting with the method, so we collect the evidence source from journal articles, conference proceedings, grey literature, and also the citation search. And after that, we screen all those evidence source using the inclusion and exclusion criteria that I will tell you later. And after we have the final document, we extract the data from those documents. We extract the source characteristic, the country-specific terminology implementation, and also the key finding for each of those four specific research questions. And after the data extraction, we synthesize the result. For the study characteristic, we present it using the frequency counts. And for the specific key findings for each research question, we use the basic qualitative analysis to allocate concept. And then after that, we make the category and the subcategory. And this is the inclusion and exclusion criteria during the screening process. So we include any journal articles, conference proceeding, books, grey literature that focus on health terminology management that are at the national level and conducted by an assigned body or the national governing body. And we also include documents from the standard developing organization about the terminology management, such as SNOMED, because sometimes what the SDO do can influence how the national level do. And then all the study design and any publication year were considered. However, we only include any English documents and also the full text reference. And for the exclusion criteria, we exclude any documents that mention about terminology management at the system level, which is the, for example, like a health information system or the application. And we also exclude the newsletter, blogs, and social media content. So here the result is quite small, but at first we found around 1,500 articles or evidence source, and after we screened that, we have the final 34. And from the 34 final documents, most of them are from grey literature, especially from the SDO websites, which are mostly from SNOMED International, and also standards from the ISO. And if we can see the distribution of year publication is start from the 1996, quite long time ago, until 2025. And we see an increasing trend of the documents published starting from 2019 up until now. Here are the study characteristics. So there is some documents from USA, Canada, Kenya, Australia, Sri Lanka, Thailand, and New Zealand. So let's start into the first research question, which is the scope of the terminology management. We have four main category, which is in the center of the circle. It's about the terminology management life cycle, the terminology content changes, the governance and policy, and also the tools and security. So for the first category, it's about the terminology management lifecycle, which focus on the main activities that need to be done to conduct the terminology management. There are 7 steps in here, which the first step is to identify the change, and if there is any request from outside, we gather the request. And after that, the change request will be validated, whether it's already appropriate to the allowable criteria that can be changed, and then assessing also the impact. And after that, usually through consensus based, the change will be approved and authorized, and after that, it will be implemented in the terminology system. And in the step 5, it's to decide when we need to release the changes, so it's change scheduling, and also we need to make the versioning of the terminology system. After all of this preparation step was done, it will be published, and we need to make a documentation of that, so it's usually a release note or any other type of documentation so that the user can know what are the changes. And then we need to communicate also to the user. So it's usually the notification to the user that there will be a change. And after all of these things, we need to maintain and review regularly to know if checking the impact, how the impact implement after the implementation, and maybe we can know any other potential changes. Then after that, we will move into the first step again. That's why it's a life cycle. So if we move into comparison of several documentation in here, there are variation of them. So the most complete one is from the ISO, but what important in here is that even though it's not available, it doesn't mean that they didn't do that. It just means that in the documentation that included in the scoping review, they don't explicitly mention about those activities. There might be done it, but it's in other documentation that are not included in this study. So in the first background, I said that a country can create their own terminology product or also adopting the terminology standards. When they are creating the terminology product, then the 7 step of the life cycle will be relevant for them. But if they only adopting, maybe the step 3, 4, and 5 might not be relevant for them because the SDO will do the changes and also the consensus, but the country can still gather the request from their area and then validate whether it is appropriate or not. And if the change are already happened, they can help the SDO to notify their user in the area that there will be a change. And for example, if they want to use that version, then they can inform the user that they will change to the new version. Move into the second category is about the terminology content. So there are 4 types of changes mainly. It's about the addition of new content, amendment, refinement, or updates of the existing content, obsolete marking or inactivation, and also the reactivation. I think the important thing in here is that we don't see any delete in here because we should not do that because of the concept permanence principle. So we can only add, update, inactivate, and reactivate. And there are a lot of terminology product that you can produce and maintain. So starting from the concept, extension, translation, mapping, reference set, and other type of terminology product. So if in the first category we talk about the main activities, the governance and policy is more about we prepare for the supporting process to conduct all of those activity, because we still need to develop the policy, the governance model, who, for example, like who will do this kind of activity and the others, and then make the standard procedure and also the guideline to conduct all of the maintenance process. And the important thing in here is that we should also think about the management of the resource and the process, where in the previous talk, they talk about the quality control. So we need to conduct the quality control, the quality assurance, and don't forget to coordinate with other stakeholders, not only in the governing body. And the important thing here is the funding management. And the last category is about the tools and security. When we conduct all those terminology management, we need to use the tooling to make all of the team conduct their job easily. And the important thing is that we still also need to limit access to the terminology system, so only qualified people can make change in the terminology system. And move into the second specific research question, which is the principle of terminology management. We found there are also 4 main categories in here about the terminology content, about the process and operational, the resource expertise, and also the governance and accountability. When we talk about the terminology content principle, we found that there are 2 main subcategory that we can talk about. First, the identifier management, where the terminology product needs to have a context-free, persistent, and unique identifier. And when there is a change, there should be maintaining the continuity and the compatibility of that terminology system or terminology product. It should have a backward compatibility, and then concept permanence. This is the principle that underlying that we should not delete any existing terminology product that has been published, and referential integrity. Usually the referential integrity is relevant for the mapping product between 2 terminology systems, because if there is update in one terminology system, we need to make sure that if there is an update, the integrity, the referential integrity is still there. Move into the second principle about the process and operational. I think the important thing is that we need to formalize all those process, and usually when authorizing the changes, there will be a consensus-based process in there. And then all of the process need to maintain the efficiency, the timeliness, and also the quality and the consistency of the changes. Move into the third principle, it's about the resource and expertise, which is mainly about the resource sustainability, which focus on financing, funding, and also from the human resource, which is usually is a team-based resource. And don't forget to involve the expert, not only the terminology expert, but also the domain expert, the technical expert who are maybe expert in the tooling for the terminology management, and make sure all of those experts are really qualified to make the changes in the terminology product or the terminology system. And the last category in the principle is about the governance and accountability, which is focus on the leadership and the authority, where the governing body should have like the central authority. And then if you have any alternative model, you can do the federated service delivery model. But the important thing is that each of the stakeholders that are joining together in the terminology management process need to have a clear accountability about their role. And after that, we need to make sure that the process are inclusive and all of the stakeholder can participate, coordinate, and collaborate. And it should be a multidiscipline as the before principle about the expert. And don't forget to also involve the user. And the last one is that we need to make sure all of this process is open, transparent, and also fair. And for the third specific research question, we searching for, is there any challenge to conduct the terminology management? And in here we found four main challenges about the version control, process and operational, resource and capacity, and also the organizational and governance. When talking about the version control complexity, it's about the challenge is about handling the historical changes and also the varied update schedule for each of the terminology standards. For example, in here in Canada, they use a lot of terminology standard, and each of them has different update schedule. The second one is about the process and operational challenge, which focusing on the challenge about the inefficient monitoring and evaluation, the lack of standardized practice, lack of automated process, and also insufficient service for reacting to user need. For example, like the service level agreement to answer about some user changes requests. And the third challenge is about the resource and capacity. I think a lot of country has these challenges. For example, because of the change of staff and then insufficient funding, and also I think there is still lack of expertise in terminology management. The last challenge is about the organizational and governance, which focus on the governance model, who will do the role and responsibility to conduct the terminology management. So it's about the fragmented coordination, there is no clear roadmap or plan, and then lack of external stakeholder participation. So they only work inside the governing body without engaging the other external stakeholder. And here is the knowledge gap. It means that we still don't know much about the terminology management in medical domain and about the organizational issue. And there are report also about the unclear resource requirement and also the effective response time to the user needs or user requests. But thankfully, we found some answer to the knowledge gap. So we found that there is an ISO 22287 in 2024 about the workforce roles and capabilities for terminology and terminology service in healthcare, which they mentioned 3 levels of role that need to be there to conduct the terminology service, which is the first one is the terminology technical specialist, which more focused on the technical aspect and the tooling. The terminology specialist is the one who do all of the terminology management process, so from creating, maintaining, and apply the quality standard. And the terminology advanced specialist is the senior level of the terminology specialist. So he or she will lead the terminology management and make all those strategy and also the policy about the prioritization protocols and the quality assurance. So the output from the terminology advanced specialist will be used by the terminology specialist to conduct the terminology management. And through this study, we know that we still have a limitation because we only include English articles and only publicly accessible documents. With we might miss the internal documents for each of the national governing body, and it's only addressed any terminology management after the first publication, not during the development. And it might be crucial because how the terminology product made during the development will later influence how the management process will be conducted later. So the conclusion in here is that health terminology management by the national level governing body emphasize the importance of comprehensive process, well-resourced, and standardized strategy for effectively updating the terminology standard. And here is our recommendation, because we still have a lot of limitation about the limited knowledge about medical terminology management in medical domain. So we propose that we should increase the publication of health terminology management at the national level, whether it's about the planning, implementation, governance, policy, funding, resource service agreement or automation tool. And the second one is that maybe we can publish a framework about the national health terminology management, which can guide any country who want to start making or discussing how they should conduct the terminology management process in their country. And I think the framework should be flexible, so it can be tailored to various countries' contexts. Yeah, I think that's it from me. Thank you very much.
Thank you, Nindya. We'll now begin question period. As a reminder, if you're in the room, please use the microphone to ask your questions so that everyone can hear clearly. Don't be shy.
Nindya, for your overview of what's there in the literature. I think I can agree on your limitation. There's a lot of gray literature and in, well, not English languages, which might be missed. But my question is the following. You found a lot of interesting and then did a very good analysis of what's in there in all these frameworks. And during your presentation, you mentioned a few times mapping between terminologies. And during these days, we also heard a lot of presentations about mapping. In your opinion, wouldn't we need a separate framework on mapping between terminologies, besides, of course, an international framework on how to, conduct your terminologies?
Yeah, thank you very much for the question. Yeah, I think each of the terminology product will have different approach, like the technicality will be different because, for example, like the mapping, they need to have like, for example, the ID for one terminology system match with the ID with another terminology system. But when we, maybe for the translation, it will have like different data element that we need to have. So I think, yes, it will be tailored for each of the terminology product, especially for the mapping, because it will combine two terminology system which maybe have different specification and schedule. So I think, yeah, I'm agreeing with you that we should have, maybe not different, but it's like, what do you call, like the child, an extra layer for each of the terminology product. Yeah.
Okay, thank you. Is this published yet, your review?
Not yet, but we are in the process for adding some more documents, and then we will publish it.
Okay,
Hopefully.
looking forward to it. Thank you.
Yeah, thank you.
Anyone else? I don't see anything online. Okay, thank you, Nindya. We will now, that concludes the session. To our online delegates, you're welcome to remain here for the next presentation in the stream, or you may navigate to another session via the event lobby. Thank you, Nindya, for an excellent presentation.